So the next disease is rabies. Rabies is a slow progressive zoonotic disease. Slow meaning it has a longer incubation period. Certainly not anything as long as like CJD, which is 15 years, but compared to things like COVID and the flu, which have an average incubation of 3 to 5 days, rabies incubation period is somewhat long. Usually it lasts usually it takes several weeks to potentially even several months to develop the signs and symptoms associated with rabies. Unfortunately, it is progressive. So once the signs and symptoms begin, it progresses very fast, and then typically does lead to death, unfortunately. And then it is a zoonotic disease, meaning it is a disease that is passed from animals to humans. It is characterized by fatal encephalitis, which is brain inflammation. And the unique thing about the rabies virus is that when it infects the brain cells, it essentially causes the brain cells to behave abnormally. So it essentially kind of hijacks the brain. And what the virus does is it causes the brain to send out abnormal signals throughout the entire body. So we'll learn a variety of different signs and symptoms that happen as a result of contracting rabies. But these signs and symptoms are happening because the rabies virus is in the brain, and it's essentially manipulated the brain to send abnormal signals throughout the rest of the body, and ultimately the signals that it sends out result in high mortality rates with this infectious disease. As far as transmission, I think we all kind of have commonly heard that rabies is transmitted through, most commonly through a bite wound. In an individual or an animal that has rabies, they are going to have the highest concentration of the virus in their saliva. So while bite wounds are a very common route of transmission, they're not the only. Any contact that you make with the saliva could be potentially dangerous and lead to transmission. So obviously, if an animal is infected and the virus is in the saliva and that animal bites you, the saliva is going to get into the bite wound. Ultimately, it will get into the blood where it will be able to get into the nervous system and lead to an infection. However, if you were attacked by an animal and that animal scratched you and created an open wound, and then some of the saliva during the incident from the animal got into that scratch wound, you could get it that way. If you were to inhale droplets and you had minor cuts or abrasions within the respiratory system, the virus could potentially get in that way. So there's a variety of different ways that the virus can be transmitted, but the common denominator is contact with saliva. That's where the majority of the virus is going to be in an infected individual, so any contact that you make with the saliva could potentially lead to transmission. So there are many different wild and even domesticated animals that can contract and then ultimately spread rabies. I don't expect you to remember any specific animals, but this chart kind of shows us the most common animals that are kind of endemic to our area as far as rabies. So definitely along the East Coast, the highest proportion of wild animals that we see infected with the rabies virus are going to be raccoons. Ultimately, these wild animals could attack us, or they could attack our pets, our dogs and cats, and that could allow them to acquire rabies, which ultimately could lead to an infection amongst us if our animals attacked us. So this kind of diagram walks us through the progression of rabies. So for this instance, we would have a domestic dog that would unfortunately be infected with the rabies virus. Maybe this dog was bit by a rabid wolf or a raccoon or whatever it be. So this dog at this point has the rabies virus. So it is going to attack a human and create a bite wound. At that point, the virus is going to get into the bite wound. It typically will stay in the bite wound for a short period of time and replicate itself, basically increase the amount of itself, increase its numbers. Once it's increased to higher numbers, then it's going to travel through the nerves, and it's essentially going to travel through the nerves all the way up to the brain. At that point, the brain becomes infected with the rabies virus. And this is what I was talking about. At this point, the rabies virus would cause the brain to send abnormal signals throughout the rest of the body, and that's going to create all the signs and symptoms that we're going to talk about next. Once the rabies virus has overtaken the brain and the signs and symptoms have started, ultimately the virus is going to spread to other areas of the body. So it doesn't just stay in the brain. It targets the brain first, but then it spreads throughout the rest of the body, the kidneys, the eyes, the heart, all different areas of the body, and even the salivary glands, where it's going to cause hypersalivation, foaming at the mouth, and that is going to increase the chances that the virus is ultimately going to get into another host. So let's assume that you do unfortunately get bit by an infected animal. So again, the rabies virus is going to start off in the bite wound. From the bite wound, it will eventually travel to the brain, will overtake the brain, and then eventually spread throughout the rest of the body. How long you have before signs and symptoms start, which is the incubation period, really does vary. It could be anywhere from a few days to a few months. So there's 3 different things that can kind of cause the incubation period to vary. We want to make sure we understand those. Probably the most important thing is the wound site. So the rule is, the closer the wound is to the brain, the faster the disease is going to progress, and the sooner you're going to get signs and symptoms. So the closer the wound is to the brain, that's going to indicate that you're going to have a shorter incubation period. So if I would get bit on my foot, the virus at that point from the wound site would have to travel through the nerves all the way up to my brain before signs and symptoms begin. That's a really long path. That would likely take several months for the virus to travel up the nerve pathway from the foot all the way to the brain. So you would have several months before signs and symptoms start. If you got bit on the hand, still pretty far away from the brain, so it would likely be a month as the virus travels the nerve pathway all the way up to the brain to initiate signs and symptoms. But if you get a neck wound or a facial wound, those wounds have very close proximity to the brain. It would likely only be a period of days before you would start to experience signs or symptoms. So the closer the wound is to the brain, the faster it does progress. Severity of the wound is also important. Obviously, the more severe the wound, the faster it progresses. If it's just a very small puncture wound, it may take a little bit of time for the virus to gain access to the nerve pathway where it can head to the brain. If it's a flesh wound, or if it's a very deep kind of flesh-removing type of wound, then the nerves would be exposed where the virus could get in right away and start traveling the pathway to the brain. Inoculation dose is also important. This is how much of the virus makes it into the wound site. If you only have a few viral particles get into the wound, they're going to have to stay at the wound site for a longer period of time to increase their numbers before they travel to the through the nerve pathway to the brain. If you get inoculated with an incredibly high dose of virus, they can skip the replication process at the wound location and go straight to the nerves and travel to the brain. So those 3 things do allow the incubation period, which is how long you have until signs and symptoms start to vary. Once signs and symptoms, or once the virus gets to the brain, then you'll experience signs and symptoms. Initially, you'll experience nonspecific signs and symptoms, nausea, vomiting, headache, that type of kind of general stuff. And then eventually you'll progress into more specific signs and symptoms as the virus completely overtakes the brain and starts to spread throughout the rest of the body. You will become delirious and start to experience hallucinations. Patients become hydrophobic or fearful of water, mainly because they are having violent muscle spasms in their throat as they try to swallow. So it's not necessarily that they're fearful of water specifically, but they're fearful of all liquids in general, even their own saliva, because when they try to swallow, it induces a muscle spasm and they choke. These muscle spasms happen outside of the throat. They typically happen throughout the entire body as well. Ultimately, it does lead to a paralytic state induced by which eventually leads to a coma, and then ultimately death. I did post a video here. It's also linked in D2L. I do highly encourage you to watch it. It can be somewhat graphic, but it is interesting to kind of follow through and watch the development of the signs and symptoms, all the way from kind of the initial prodromal phase, all the way up through hydrophobia, muscle spasms, and then to the paralytic, and eventually the comatose state followed by death. So that is an interesting video of watching someone unfortunately succumb to a rabies infection. So the one fortunate thing about rabies is that once you become infected, you do have some time before signs and symptoms start. You obviously have more time if you're a bit farther away from the brain. Because of that, you can get treatment before signs and symptoms start. So if you would ever get bit by an animal or attacked by an animal that you suspect had rabies, you want to go to the hospital right away. You need to seek treatment before signs and symptoms begin. Unfortunately, if you wait until signs and symptoms begin, it's 100% fatal. Once signs and symptoms begin, the virus is already in the brain. It has already hijacked the brain. It is already starting to spread throughout the rest of the body, and sadly enough, there's really nothing that can be done. They will typically put you in a medically induced coma, give you things to try to boost your immune system, but most of the time, patients unfortunately do pass. Luckily, if you get treatment before signs and symptoms begin, the rabies virus does not progress, it does not get into the brain tissue, and you do not succumb to the disease. So if you get bit by an infected animal, you go to the hospital. They're going to wash out the wound to get rid of any dirt, debris, free viral particles, maybe even bacteria that got in there during the altercation. And then they're going to give you a series of injections. The first thing they're going to do is inject you with immunoglobulins or antibodies. These are going to bind to any of the free virus and neutralize it so that it cannot infect any of your cells. Ultimately, there is a concern, though, that some viral particles have already infected cells at that point. So to kind of combat that process, you also have to get several doses of the vaccine. The vaccine is going to stimulate your immune system into producing and activating cells that can fight virus-infected cells, like cytotoxic T cells, and the production of further antibodies to fight off the infection. So you would get your first dose on day 1 when you go to the hospital. Then you would have to come back at day 3, get another dose, back at day 7 for another dose, and then back at day 14 for your fourth dose. But as long as you undergo this medical treatment before signs and symptoms begin, the infection will not progress, it will not get into the brain, and you will not develop full-blown rabies, if you will. But unfortunately, if you wait until you start to experience even the non-specific signs or symptoms, at that point, unfortunately, it is too late. So just as a general life rule, if you are ever attacked by an animal and you have a suspicion that potentially the animal had rabies, you would want to go to the hospital right away and get the necessary injections.